Good evening, everyone, and thank you for joining me tonight for another episode of Spanning the Need. I'm your host, Anthony Spano. Tonight, my guests are from the city of Youngstown, Mayor Tito Brown and our Health Commissioner, Erin Bishop. Gentlemen, Mayor, Erin, thank you for taking the time out of your busy schedules and joining me tonight.
Thanks for having us, Tony.
Well, and as everyone can see, Erin is sitting at home and the mayor's driving. He's a very busy man, so I appreciate his time and effort because I know he's going to a variety of different places. So let's jump right in and get started. Mayor, you've been mayor for approximately about a year, 2 years. How did you get started in becoming in politics? What really made you jump into politics, especially nowadays?
Yeah, Tony. I'm working on my third year as mayor. I don't necessarily say I jumped into politics. I jumped into public service, and it just led me to an elected position. And that probably dates back to my original start on the Youngstown City School Board, being a city councilman, the president of council, and then now mayor of the city of Youngstown. So I didn't look at it that I was going to go into politics. I just wanted to be a public servant. And first start was I wanted to help my school system. Then I wanted to help my neighborhood, and then kind of territory started expanding. And here we are, my third year, and my first term as mayor of the city of Youngstown.
And it's funny we look at what's been happening in your third year, and we talk about, and we'll get a little bit into COVID, that you're basically here to serve. You love serving the people of the city of Youngstown. Would you agree with that statement?
Absolutely. You have to have a servant heart, Tony. One of the things I tell people, there's not a job above my pay grade or below my pay grade. I'll do it all if it's going to satisfy and move the city of Youngstown forward.
And then you have probably lately you've been working closely with your health commissioner in the last 6 months, Erin Bishop. Erin, talk about kind of how you got into the role in health and public health, and now you're city commissioner, and you probably never realized that you would ever have a pandemic like this.
No, definitely not. So I was born and raised here in Youngstown, Ohio, and graduated from Ursuline High School, went down the street to Youngstown State University. I was kind of like figuring out what I wanted to do. I know I wanted to help people, but I also liked the health field. So I tried like social work, physical therapy, and then I was doing some work in the HIV/AIDS ministry, and met a colleague who was interested, told me he was in community health, and I said, I never even heard of it. So when I went and spoke with the faculty advisor, her name was Dr. Kathy Akpom, she kind of just told me all about it and helped me plan out the next 2 years, and the rest was history. So I got and then her big thing was, and then you'll graduate and then you'll go right on for your master's. I was like, easy, I just like degree and be done. No. Right. So 6 years later, so I did go right back to get a master's in public health, and it was through NeoMed, but it was through like a consortium with Youngstown State, Kent State, Akron. And so I graduated with that, and everyone said, well, what do you want to do with that? And I'm like, well, I guess my dream job would be health commissioner for, the city of Youngstown, because I truly never left Youngstown. I always wanted to stay in Youngstown. My mom and dad were here. My grandmas were here. So it was just like the city meant a lot to us, and I didn't want to leave. I had never intention to leave. And so if I'm going to stay around here, I might as well work and care for the city that I so love. So long story short, Jay Williams, Neil Altman, was the former health commissioner. He leaves. Jay Williams offers me the job. It just kind of all happened so quickly. And here I am almost 10 years later as commissioner. So I think one of the things that, can you hear me?
Yeah, loud and clear.
Okay, I'm sorry. So I guess one of the funny parts is that, this is when people say you got your dream job, I truly do. And I have loved every minute of it. At times it's tough, and it has been tough, but there's been nothing. And it's funny because we plan to have these outbreaks, and you do when you go to those, they're boring classes. They're all day long, these like fake tabletops. And you're like, okay, rolling your eyes like this ain't ever happening. So, I mean, we really didn't think it was going to happen. So then when it truly did happen, we were prepared, or so we thought. So this is kind of where we're at now. And we're into our, 8th month of COVID-19. And I'm sure we're going to talk about it a little bit more.
Yeah, and it's funny because between Mayor, between you and your health commissioner, you probably didn't feel that during your term that you'd be seeing or talking to the health commissioner on either a daily or a 5 times a day in the pandemic.
Yeah.
Well, it definitely helped you realize, how great of a team you have. And Tony, one of the things I have an awesome opportunity to do as well as be the mayor. I'm the chair of the Health Commission board. So I had a chance to learn the staff and see their talent that they had. But also, you don't realize it until you get into a pandemic that you really have a great team. We're one of 113 health departments across the state of Ohio. And whenever I'm on the phone with my colleagues and other mayors across Ohio, we talk about our health departments. And I'm always so proud to talk about what we're doing in the city and how we work together. And I think if you look at our results of, when we put that, when we first learned about it, and Erin can tell you the story of how we put our COVID team together. And we've been, I can't say we've been rocking ever since during this pandemic, but we've really got a sense of, here's what we're going to do here. Here's what we're going to do there. And as Ann said, there were some tough decisions we had to make, and they were not easy, but they were comfortable in our heart that we were doing the right thing.
Well, and I think that the biggest thing is, and I think that you actually had, I don't know if I wouldn't say a scare, but you actually were contacted by Trumbull County. They're tracing individuals that you may have been exposed to COVID-19 when you were out and about. Is that correct?
That was correct. You come in contact with someone you hadn't seen the gentleman in years, and we start catching up about kids and the wife. And because I talked to him, and we were at a restaurant without my mask on, it was that glimpse. It was that small window, and we had been preaching about wearing your mask. So it's all the time you should wear your mask, but it's hard when you're out at a restaurant and you start talking to someone. But we see that happens more often than not. So we were fortunate that we tested negative and there was no symptoms on our side. So, but it's just another lesson learned, and we got to continue to push and let people know you got to wear your mask.
Let me ask you this, and let me follow up with that, Mayor. And what did you feel when you first got that call? Like, what was your first instinct when you got the call?
Well, it was kind of, first of all, you get a call from the health, and they're not talking about, can you sign something? It's like, well, tell me why you're calling. They give you the scenario. Hey, you ran into such and such. I'm like, yeah. They say, well, you talked to them for such and such a long time. And it was just one of them, like, wow, there it is. It was right in front of you. So the reality of the virus is there. And the one thing I learned, and we talk about it all the time, you must respect this virus and this disease, but because it has no friend or enemy, it takes everyone at the same level.
Well, and I think that brings up a great, that would fall into my next question is, and this can be Erin or the mayor, is what do you say to people that think it's a hoax, or that it's certain lawmakers are just trying to scare you with these horror stories like, we don't, nothing to worry about or anything like that? What do you have to say to them, Erin?
Yeah. So unfortunately, I have been getting that since the very first day it happened. And it's always trying to explain to them that there's times I say, I wish it was, I truly do, you know what I mean? But unfortunately it isn't. It's alive and well here. And, I give them the facts. I give them the facts that as of today, we have had 119 confirmed cases, in just the city of Youngstown. With that, we've also had 408 that were tested that were not cases. So it is who it is affecting here. It's an average age of 50 years old, and it's affecting everybody. I tell them stories about people that I personally know. I lost my great aunt. She was a nun. at a convent in the Bronx, and I think there was, out of like 25 of the nuns, 19 of them passed away. They all had COVID. It got into their convent, and they all unfortunately passed away. So it hit me, my own family. I had friends. I've had, friends that were my age that were in the hospital and on oxygen. So I had these stories to tell them that, this isn't just something that you read about or you see on the news. Like, there are people here in Mahoning County, in the city of Youngstown, that have lost loved ones. And so, it is true. And I think, as you see celebrities and sports figures and different people on the news, and, when Cuomo from CNN got it, so you were just seeing, like, it wasn't really like they were putting faces to it. I was watching MSNBC before we got on, and there was just, they do stories every night. And the guy was 28 years old, and said goodbye to his mom, made a heart out of his fingers to say goodbye because she couldn't be there for him. So I always kind of bring it to life in the stories that I hear, and personal, whether that or from what I've heard. And I think it makes people wonder, or, realize that it is here. Or when you're shutting down places and people can't go, or you're opening up schools and you have to send kids home from a school, I think then it wakes people up and think, no, this really is happening.
And Mayor, how do you follow up? Well, let me follow up with that. How do you follow up, and as a leader in the community, the faith-based community as well, how are you communicating that information to those individuals in the city?
Ironically, you say that, and Erin will tell you that we had weekly clergy calls because we had to figure out a avenue to get that information out to those in the city. So we had the local clergy, all different faiths, come together weekly, and now we're at a point we go bi-weekly. Actually, every Thursday, Erin comes on, gives her testimony. She gives her, she talks about the issues and the facts that we have going on in the city. I talked a little bit about where we are with my calls with the governor and the mayors across Ohio, and what they can expect to come down the pike. And it's been very helpful for us communicating with our clergy on a week. Just like I said, we were going weekly. Now we're going bi-weekly, and just to keep them up to date. And many of them, they followed our lead, and they've been working as a team and not opening their church. If they do it, is only because of a funeral. So it's been a great experience, and I think we've built a lot of coalitions and a lot of friendships during this time because we gave them the facts and not fear. And many of them said, you know what, we want to save lives, and we're going to work with you, and that's been a plus for us.
Well, and let me follow up, because I think it was, now correct me if I'm wrong, Mayor, was it in April, maybe May, that you were actually appointed to Governor DeWine's strike force?
Correct. Yeah, I was. Yes.
How was that experience? Because you get to talk to a variety of people all over the state and how they're handling it.
You know what? One of the things I always want to make sure that if I'm on something, that there's some tangibles, but also that it will benefit the city of Youngstown. And we had an opportunity to really start spotlighting the needs and how vulnerable our population was here, right in the city of Youngstown. And I think that goes back to why we're able to have our pop-up testing weekly right now, National Guard, because of my involvement and Erin's involvement with the governor and his team. And they realized that Youngstown, we needed their help, but we were ready to help as well to our partnerships.
Well, and that's great to hear that we're being showcased, or at least people are knowing at the state level what our issues are, and we're not being discarded like, you know how it is, every city, well, the state's not hearing our voice. We're not able to do whatever that is at the state level or get funding. And I think that brings up a great follow-up. Erin, could you give us updated numbers on COVID, how many tests you guys have ran? I think you mentioned that. And what age group does it affect the most, at least in the city of Youngstown? I think I lost her. Did I lose her? Erin, you there?
I'm here. Do you hear me?
Yeah, I can hear you. I wanted to follow up, but let me repeat the question. The question is that, can you give updated numbers on COVID, how many tests that have been done, what age group is the most, is it affecting, at least in the city of Youngstown?
Sure. So I can give you some numbers, and for confirmed cases as of today, so this is fresh off the press, we have 919, and this is overall cases, and that we had 130 hospitalizations from out of that 919, and we've had 46 deaths. And again, this is just in the city of Youngstown. 55% of the people with COVID are female and 45 male. The average age is 50 years old, and we range anywhere from 0 to 99. When we talk about, who are people with COVID, 38% of our cases reside in long-term care facilities, and 23% work in those long-term care facilities. So that's where we saw a lot of our cases, and we are seeing now. We did just have an outbreak in one of our nursing homes with 25 persons testing positive. And so we saw that right at the beginning, and then unfortunately we're seeing that again. So we're working with them again. We also have seen, what is this here? Let's see. I give these right numbers. So about 3% work at school or college or universities, and then the rest are direct patient care. We also had people that were incarcerated, so we worked with them. When we're talking about, let me see this part now. For our race, for all COVID related, 43% Black, 30% white, and 27% were other or unknown. And when we talk about testing, so I just was kind of pulling the numbers together from our last 2 testing sites. So in the last 2 weeks, we've done 107 tests, and 175. And out of those, we had 9 positive tests. So that just kind of gives you an update of just in the last 2 weeks that we've been testing. And what we do when we do our own testing, then we're able to see those numbers and how many people were tested. And we also get the spreadsheet. So if someone doesn't have an email or can't get to it, we'll call them at home and give them their results. So that's been great because we've had control over that. Because a lot of the times people were just getting tested at other places, which is great that we have them. We have different rapid care places, Quick Med, that's able to get them, some of them turned around in 20 minutes, but ours now we have control over that. So those are just I just wanted to give you those numbers because it's numbers that I have that how many people were tested in the last.
So let me ask you this question. Over the last month or two, have the numbers of positive cases kind of gone down? Is there a downward trend, or are we looking at just kind of stable across the board?
So we were doing great. We were having this downward trend. And then unfortunately, just in the last week, we had an increase of 68. But like I said, we had 25 that were in the long-term care. And then we had another long-term care with 13. So half of that was from one of those long-term care facilities. So I think that's where our numbers spiked. So we have seen this increase now. And then again, we've been getting couple in schools. The schools opened up. So that's something new. So we're seeing a little increase there. And, with our sports and that all kind of opened. I mean, as you start to open, and then Youngstown State University, because that is our jurisdiction. So any of the students that get tested, if they test positive, they're considered a Youngstown number.
Okay, so that's how that works. Okay.
Yeah, so we've been really encouraging the students because the governor wants about 3% of the population on Youngstown State's campus to be tested. So they're encouraged them to utilize our free COVID testing on those Thursdays. And last week, it was at the congregation Rodolph Shalom on Elm Street. So they were able to walk from the dorms. And then this Thursday, it's at Union Baptist Church, which is on Lincoln Avenue. So very close to the university, very close to the university edge. So those students will have an easy time. They could drive over, or they can, walk 2 blocks and we'll be able to get tested. So
someone watching this, all that information that you just gave us, can they find that on a website?
Yeah. So we are very lucky to have a great website at the City of Youngstown, which has all this up-to-date information. We also have the testing. We put it on Facebook, Twitter, all our social media accounts have all this information of when to be tested, how to get tested. And then also we usually will put on, like, the governor puts it on his Facebook, so we'll share that, and it seems to get all that information out.
That's good to know that people can access that anywhere that they are. Well, Mayor, let me go back to you on this. And now we have a pandemic. We're in March. Now we're in April. You guys thought it was so bad that you instrumental created a mask order. Can you explain a little bit about what came about and why you thought that was a good idea?
Tony, I think we as a team, when we would meet, we looked at what the CDC, we looked at what Ohio Department of Health, and all the scientists were telling us that the masks were a good barrier, and it wasn't for me. It was for me to protect you. So we came together and we said, you know what? Here's what's happening. I talked to my colleagues across Ohio, and many of them had started putting a mask order out. And we decided that was something we needed to do. When we talked to our clergy, we talked to the community. Many community members were open for it. They were ready for it. And when we did it, I think that was a game changer as it related to seeing our numbers become just a steady number. And then you saw the reduction because everyone had to wear a mask no matter where you went out in public. I think it made, it was not like that was one of those tough decisions. Everybody, they pushed back. I don't want to wear a mask. You don't have to wear one if you're not out in public. But if you're out in public, you had to wear a mask. So that was team effort. Our COVID-19 team came up with that, working along with our clergy and our community.
And let me ask you this: how did that change the operations when COVID hit? You got a mask order now, and now you're in the middle of a pandemic where everyone's home. Youngstown State shuts down. A lot of businesses send their people home. How did the operations or the city of Youngstown handle that effort behind the scenes? And not many people may know what you did. They may know what Youngstown State did, or how did the city handle that during the pandemic?
I mean, we became flexible. We went remote. If you called during the pandemic, you called the mayor's office, somebody was going to answer the phone. So we took out the old rule book that you had to come to City Hall to do the job. We closed off public access to City Hall because we didn't want anyone to be in City Hall. So we closed that off, and also city-owned buildings. We took that as a priority for us. So we really were flexible. We were open, and we made sure that the safety of the citizens were first.
Well, and I think from what I'm seeing, that from what Erin's telling us, that let me ask you this before I go further. Are we around 64,000 population wise in the city of Youngstown?
Yes, sir.
Yeah. Mm-hmm.
Okay, so we're about there. And I think that shows the commend that you guys have done for where do you see the playbook for this, for a pandemic? I mean, you really don't.
Well, Erin might. It's ironic. You say that, but when you get a chance to learn about how important public health is, if you talk to her team, they tell you they trained for this. I can tell you as mayor, I didn't train for a pandemic or economic crisis that we're facing right now. But you got to stand up, and you got to show your leadership, and you got to be able to lead during these difficult times and make some tough decisions. But Erin and her team, they've been ready, and you can see it in their growth. You can see what when I talk to people across the state, they talk about our health department in the city and how blessed I am to have a health department that is ready to go at a moment's notice, and we can pivot on a dime. They something happens or changes. Like she said, you get an outbreak, we know where it's happening. We get in there and we work through it, and we try to contain that and figure out and doing our contact tracing. So the safety is first, but they're good at what they do, Tony.
And that's good to hear that we have a first-class health department. And first to none, you don't have very many areas that and I think we just lost the mayor, but I think I can still hear him with audio. So the mayor's on audio, so we still got him. We talk about, and Mayor, I'll follow up with this or Erin. So we just found out that you guys got $2.9 million, give or take, correct me if I'm wrong, of federal COVID relief money. How will you use that to either help your finances in the city to continue to fund services? Will that be more COVID related purchases? What will that go towards in regards to the city of Youngstown? Either Erin or the mayor.
Go ahead, Erin.
Okay. So I was going to talk a little bit about some different pots of money that we've been getting through the Ohio Department of Health. And one of what we just got recently is to really help people that have COVID or are a contact of someone with COVID that is, in quarantine for 14 days. We want to be able to help them if, they're back on their rent, if they can't pay their utilities, if they need some help getting some cleaning supplies, getting some extra groceries, we're able to do that. So we're utilizing, we do have a couple people in our office that are, social workers by night, but work for the health department during the day. So they're ready to go and start helping. So what we'll do is our contact tracers, when they find out that they need extra help, they will hook them up with a social worker at the health department, who will then in turn see what they need, assess their needs. And then we're working with MyCap and Catholic Charities Regional Agency, and then we'll be able to help, pay their bill, whatever they need. We just don't want them to get back, on anything, because if if I had to be off for 2 weeks, I have sick time, I'm able to take that. Whereas my husband, who works in construction, if he was off for 2 weeks, he would not get paid at all. He doesn't get any type of paid vacation or sick time. So I could just imagine what it would be like for us not to have 2 weeks of a paycheck. And so I think about those families and what they need. So we need to know what they need, and we'll assess that, and then we'll help them as much as we can. I know that, the city, as you're saying, the $2 million, we're utilizing it to help, again, our citizens. That's most important, what they need. And it's always just how we can help them. And in every person, every case is a different story, is a different need. So, obviously we'll work with that. We're also utilizing a lot of that money to pay for all of our time that we spent to COVID-19. I think we were figuring out that the health department, almost 80% of our time was spent on COVID. I mean, we spent hours, we had 12, 15-hour days. It was just nonstop at the beginning. And now it's like picking up again. So, and just being able to utilize those funds for that. And we utilized them in the fire and the police, all the time they spent working on that, and the training and the cleaning of all their equipment, and their, after the officer got out, it's no more just get out of the car, throw away your trash. It's wipe everything down and spray it down. So we had all these protocols set in place that everyone had to follow. And, we were able to utilize all that. We worked with our parks department. We helped, when the Youngstown City Schools shut down, they didn't have anyone working for them at the time, because a lot of them were quarantined. So we went and picked up and started to deliver, or to do the food, the lunches, and everyone jumped in for that. So there's just been so many things that we've done behind the scenes that we're able to use that money for. And, you're going to constantly see, different agencies getting money. And our goal is just to get it spent and it gets in the right hands of the right people.
Tony, one of the things you got to realize with the COVID funds, they kind of tell you, they give you a prescription of what you can use those funds for. What we have not had a chance to get, and when everyone else were getting stimulus, and you probably saw the president say that today, that local communities, cities, have not seen any revenue replacement because we lost economic, during the time of the shutdown. We deal with income tax, sales tax. State of Ohio is a lot different than other communities. Other communities or other states, they deal only with real estate, and that's how the cities are funded. We're funded through taxes, income tax, gas tax. So those things we didn't get back yet. And we've been trying to work with our federal legislators to get some stimulus for cities. And you can see that the bone of contention. And now it's become a political, fight as well. Now we're not going to help, and they say Democrat mayors, but it's mayors across the aisle as well. I'm a part of a mayor's alliance across Ohio, and it's nonpartisan. These are both Republican and Democrat mayors who have lost revenue, and those COVID funds they send, it's not for revenue replacement. So that's where the challenge has come for cities like Youngstown, Ohio. We're fortunate that we have a governor who, and the legislators have passed some of those dollars our way, and we've taken good notes, copious notes, and said, here's how we can adapt and use those to help with things that get people working, like Erin said, or make sure that we're helping people who really need it during COVID-19. But make no mistake about it, cities across the nation need revenue replacement.
Well, just out of curiosity, have you guys still been within budget this year, or has that kind of gone out the door because of what you just talked about?
No, we're still, fortunately, we are still doing well. We're not hit hard like others, but you don't know.
Right.
Business may open back up today, and 5 may shut down next month, and we're dependent on that income tax. And if those income tax numbers are coming in, we've been watching quarterly, and there's going to be a shortfall, and that's why we look to our federal legislators. And we had, the senators from Ohio, they were ready to go, and I see today that this administration is saying that they're not going to do any more. They don't negotiate anymore until after the election. So the people of Youngstown, Ohio, and across the state of Ohio, across the nation, will suffer because of this made it politicized.
Well, and it's weird how, and I'll say this is, he gets out of the hospital and then says, stop negotiating. I think that was a little, I would have liked to see negotiating continue, because now if you're waiting till after the election, that's 28 days away, or so you're not going to have any negotiations. So now what doesn't say that, okay, if he doesn't win or wins, he's going to negotiate it after the election, and then you're at lame duck session.
Yeah, you just kind of look where the priorities are, and the priority right now is the Supreme Court, and they decided the cities, and they keep saying Democrat mayors across the nation, but it's not just Democrat. It's Democrat and Republican. It's just communities. They want to make COVID-19 a partisan issue. It's not a Republican issue. It's not a Democrat issue. It's a people issue. And the more that they make it political, the more the people suffer.
Yeah, and I would agree with that. So, but I appreciate the comments on both ends. And let's talk about, now we have COVID hitting our area. Businesses are either shut down or open. How is that affecting economic development for the city?
Ironically enough, there's still a lot of things that are still working. Construction continued on. If you look at Phelps Street, we just had a new restaurant open downtown. We've had a couple new local developers who have bought buildings and want to invest. So ironically enough, those that had plans already in place and have been working with the city are still moving forward. I just had lunch with a gentleman today, and they're going to make another announcement where we were selected from a national R&D to do some R&D, and there'll be some jobs there right here in the city of Youngstown. So with the whole technology, with the energy that's coming out of R&D, I think that's going to be a big piece for us. But we've got to still make sure that our workforce, they have the skills. But also we need to make sure that when people come in, that we've got to remove that toxic environment. People look at the corruption that we've had in the past. And Tony, the one thing I tell people now, we turn. I can tell that Youngstown's open for business. You don't have to owe anybody. You don't have to pay anybody. I think that's the message that we have to give to those who want to invest in the city of Youngstown. And we're seeing people coming around. We've got the federal EPA director coming in the city of Youngstown tomorrow to see what's going on in Youngstown. So that's another opportunity for this administration to be at the table. And we're at the table with the governor. Now we're at the table with the federal level as well.
Well, and I think that brings a good excuse me, a good avenue that the city is open for business and still moving forward, pandemic or no pandemic.
Sure.
And well, let's talk about that. And we talked about the health of the city finances. We talked about the COVID money. What are kind of your plans, Erin, or even the mayor, about moving forward in this pandemic with the city? What's coming down the road, or what you would like to see in the next year? Because from what I'm getting is I hear people saying that we're not going to be out of the pandemic till spring of 2021. I have people saying that as soon as the election's done on November 4th, we're going to be done with the pandemic.
Yeah,
I'll let my dynamic health commissioner answer that one. I know what she's going to tell you.
Well, I was hoping that that's what happens the day after election, but I truly don't believe that is going to happen. But what we're continuing to do, and we ask people about the testing when we're at testing and what they think of even just the mask mandates. And I cannot tell you, every single person that we talk to is glad that they have the mask and they're comfortable. They feel that helped. I think that's going to stay with us for a while. I don't see that changing at all. I think we're going to continue. We are lucky at the health department to have a great epidemiologist. We have a 7 contact tracers that work. So I know we'll continue to work on that and making sure that the people that are positive know what's going on, and that we keep the people that they're in contact with quarantined so that it doesn't spread. And I mean, I know 919 sounds like a whole lot of people, but when you compare it to the 65,000 that are in the city, I think we've done a great job. And I think a lot of that has to do with who we are and who are people that just listen and really want everyone to be okay and take care of one another. I've always thought that about Youngstown and our community. Just as much as the mayor takes care of us and the health department, we take care of each other. And so I see that it's live here in Mahoning County, in the city of Youngstown, as we see so many people do wear the mask. I have to say, I see it a heck of a lot more than I talk to other health commissioners throughout the state that will say they have probably about a 30% wearing of the people wearing. I'm like, 30%? I would say sometimes on a good day, I see like 95% of people wearing the mask here. And I mean that. I'm not trying to make that up. I truly, I mean, I can't tell you. And I hear these health commissioners talk and I'm just in shock. But we also are planning for, if we do get a vaccine, sooner or later, when we get it, we have to be planning for what does that mass distribution look like? And those are a lot of those tabletops I was talking about. We always practice, okay, if there's a mass vaccination, what do we do? And, keeping the crowd control down, and all these people are going to just come about the Covelli Center and want these, how do we keep everybody safe?
Oh, the mayor, he'll barricade himself right at the door waiting.
So that's what we have to work on. And so we have those plans. We've been planning that. So we're ready to go. We've been purchasing some things like, yellow vests, just stuff like that we can get, that we're ready to go. So, each day we're thinking of some other things. We're trying to be creative. And I just think we'll continue to be in open communication with our community, which I think we've done a great job of doing it. We pass every day. We send the numbers out so people can see. We also, at the beginning, we're doing Facebook Live. The mayor and I have been on, PSAs. We've done commercials. So I think we are getting the word out there. We also do a lot of outreach in our community. I mean, every Friday night, instead of watching football games in the stands like I like to do, I was out at least till the third quarter, out at the bottom of Stambaugh Stadium, passing out whether it was hand sanitizer, masks if people need it. And then we'd go and work the halftime, making sure people were, spacing out at YSU. And then, I got to enjoy like maybe half the third quarter, fourth quarter of the game. But that's what, and then we went to the different things at the Covelli or at the amphitheater. And, when people walked in, if they needed masks, we had them there. We had hand sanitizers for them there. So, and then we'll continue to just always do outreach and continue to keep our, we have a COVID task force team that's been since day one. I was doing a presentation at the YMCA for the Rotary, Youngstown Rotary, and I was speaking. And when I kind of stopped speaking, Scott Schulich raised his hand. He said, "Erin, I just want to," he goes, "I just want to know, when you were speaking, I just got a text that said the World Health Organization declared COVID-19 a pandemic." And I'm like, "Oh my God." And then I get this text from the mayor. He's like, "We're all meeting over at the health department. Where the governor's addressing us." I'm like, "What is going on?" Like, it just happened so quickly. And from that point on, we had our task force. And then, week after that, we were shutting things down. So it just happened so quickly. But we still have that team. We just met this morning or this afternoon. We still we pulled in, planning, economic development, our building and grounds, parks department, code enforcement, like we're all our health or our police, fire, we're all on this team together. So we really have just come out strong. And I think of them too as like my sanity sometimes, like you need people say, "How do you get through it?" Well, you get through it by having a great staff and then good friends and good family. But my work family has really, really stepped up and just, we support each other, and I really couldn't do it without them. So I always will. We can look back on this. I keep saying, I can't wait to look back on this time and laugh and think about remember when, but I just feel like it's never coming. So, but we will look back on this and know that we got through it. I hope it never happens again. I hope it doesn't happen for another 102 years, but I think they'll have a better playbook because, back in the day, like they just were kind of winging it too. And, they didn't have all the stuff that we have now and the ways to, I think about how did they get all this information out there without, computer and social media, but we've been able to do that so well. And so,
well, I think it helps. I know they started using the Spanish flu numbers just as a basis. So I think that at least got it started in some capacity of assuming what it would do.
Mm-hmm.
So, Mayor,
I was just going to say, what also gives me hope is, other countries have gotten it under control. You know what I mean? So I'm not worried. Like, it can be done. It's just like, why is it taking our country out of, best country in the world to like get it together? So
exactly,
we'll just keep doing it.
Yeah, Mayor, what can you tell that your plans, besides the pandemic, what are you looking forward to, or what are you looking at trying to enact in economic development over the rest of your term and beyond?
Well, I think, one thing we need to focus on is going to be 2020 and beyond. We've got to make sure that we focus on housing. And I talked a little bit about the partnerships that we've been able to establish that have been broken, and also to actually strengthen relationships that we had. We'd like to see some joint corridor studies and economic development projects that we're working with other townships and cities that we connect with, like Belmont, Market Street. Those things are working now and happening. But we got to make sure, one of the things I want to focus on is, we talk about a workforce development, but I want to make sure that that's that one-stop shop. What I hear often people say is that, well, there's no jobs here. That's from the employee, but then the employer says there's no workforce here. So what we're working on now is putting together kind of that one-stop shop where you can go and find out where the jobs are. If I'm an employer, I can go get find individuals who have the skills that I need. And if those individuals don't have that skill, we're bringing in the community college as well as Youngstown State. Maybe there's a certification or certificate that those individuals can get to satisfy those skills that employer needs. And so we're trying to marry those two because we think it's got to just not just be a Youngstown issue. It's got to be a regional. And tomorrow I'll be speaking with Mayor Paduto and a couple other mayors across what we call the Northeast region. That's the Ohio, Pennsylvania, West Virginia area, where we'll be talking about that global regional approach where we can all come together and bring our resources. So it just won't be me trying to do it by myself in Youngstown or in the Mahoney Valley. Now we're going to bring in some, the Spurs in the West Virginia and see what we can collectively come together with. So tomorrow morning, that's I'm on a panel to talk about that. So I've realized that we've got to expand our footprint. We got to do a thing a lot different, and we've got to make sure that we're networking with those who have opportunities to bring in development and investment.
Well, I know you guys are doing a lot for the city, and I commend you for what you're doing. And I thank you. It's always a pleasure. I thank you for taking time out of your busy schedules.
So thanks for having us.
Really, thank you for having us. I really enjoyed it. It went so fast, 45 minutes. I'm like, it's already over.
Yeah,
it was so fast. Mayor, are you
just
yet?
Yeah, I'm almost there. Yeah, I'm almost there.
He's still. Yeah, just to let you know, the mayor's on. He's on. He was on, and now we got him by phone. So, but Mayor Erin, thank you for taking time out of your busy schedules. You're always welcome on the show. I hope to have you guys back in the future to give more updates in maybe the next quarter. Thank you everyone for joining us. Check out other podcasts or other interviews at anthonyvspano.com. Have a great night.